What's up, everyone? Welcome back to the Daily Sean. For those of you who haven't been here before, my name is Sean. I do a daily video on something related to nursing. No rhyme or reason. Probably not going to change. Question from the tribe today. How do you keep your staff calm during an emergency, during a rapid response? Everybody has a different term for it. You have the cardiac arrests, and then you have the rapid responses, which have been a push from JCO, which is a change in condition or an emergent change in a patient's condition. So you call a rapid response in as a way to prevent a cardiac arrest. And this is an interesting question because there's no actual recipe. It really has everything to do with the staff that is in charge and leadership, and ultimately the team leader. 99.9999% of the time, the team leader is the physician. So the physician or provider sets the tone for the entire room. Now, if the team leader is not establishing and maintaining order, then it's going to be up to you and other members of the response team to try and initiate or to try and stop the cascading event. There's two types of disorder when it comes to a rapid response or a cardiac arrest. Some people call them conditions, code blues, take your pick. Everybody has different nomenclature. But there's two types of disorder. There's the first type of disorder, which is just staff disorder, staff disorientation, staffing chaos, or disorganization from the staff itself. This type of chaos is easy to fix, and it's quite honestly not a priority. As long as the patient is being cared for in an appropriate manner, you probably can handle whatever type of chaos is surrounding the patient, as long as the care that's being provided is direct and intentional. To solve and correct this type of disorganization, it's just a matter of one or two members of the staff trying to focus on the intent and not focus on the actual disorganization. The second type of disorganization is the more lethal and more toxic, and also the more deadly. And that's disorganized care, chaotic care. The chaos from the team and the staff and the leadership is spilling over into the actual care provided to the patient. Things are being missed. Things are being repeated. There's inconsistencies in therapy. There's unreliability in the assessment skills or the assessment of the team. Is there a pulse? Is there not a pulse? What kind of rhythm is that? Disorganized. Do we actually have a pulse? Do you actually have an adequate airway? Is the airway confirmed? These type of chaotic events are detrimental to the care of the patient and have to be solved immediately. And that should be solved by the team leader, once again the provider. And if the provider does not recognize the disorganization, the chaos, then you as the staff nurse responding to the team need to figure out a way to focus the team on what's more important. The peripheral chaos or the chaotic intervention. The chaotic intervention of the patient is the most important. So you need to make sure you focus on the patient all the time. Never focus on a singular individual or a series of individuals. Never focus on the equipment. Never focus on what's not being done. Focus on what needs to be done. Focus on what has to be done, and focus on how to do that. You all had the same training, same education when it comes to advanced cardiac life support. We all have differing perspectives, but at the end of the day, we all know the protocols. We all know what needs and not need to be done. So focus on what needs to be done. And if you haven't had advanced cardiac life support, you have basic life support. You know the ABCs. You know your CPR. Focus on that. Focus on the patient and not what everybody else is not doing. Sadly, there will be instances where everything you do is unsuccessful in wrangling the troops to focus on what needs to be done. And every so often, someone's going to have to lose their cool. Sadly, it's happened to me. I've been in the room when the leadership team has had to raise their voices and lose their cool. I have unfortunately had to do it. It sometimes needs done. It's not appropriate. It's not something that should be done on a regular basis. Every case is rare. Every case is unique depending on the patient. But at the end of the day, it's about the patient. It's about the care. And it's about working as a team. What says the tribe? If you've been a part of the chaotic mess that we call the rapid response, what has been the catalyst for organizing the chaos? What have you noticed that is present in the organized responses versus the chaotic responses? What's missing? What is present and not present? Would love to hear your thoughts on this one, because once again, my answer is not always the best answer. I guarantee you there are other individuals out there that have had the same, if not more, experience than I have with this particular scenario. Would love to hear your thoughts. Leave your comment down below. You know your comments are my caffeine. Share this with somebody. Share it with anyone that can benefit from it. Share it with the new nurses. Share it with the seasoned nurses. If you are friends with leadership, share it with them. Would love to get everyone's input on this. Be sure to share the vlog and pass it on. And as always, check your own pulse first.